Okay, we're live. So we should do like on the radio station from Penny Doyle Live Center. Good morning, welcome everyone to the Knox County Commissioners regular session, March 6, 2025. We know people are slip sliding around in the county, so do be safe out there. We did have someone that was supposed to come at 10 o'clock. We have not heard from them, so we will go ahead and start doing our resolutions and going through some items. We may have a period of maybe 15-20 minutes where we won't be doing anything because we have Zach Green coming in from the Knox Public Health. And then at 11 o'clock, we have Julie Miller coming in for the Senior Levy Committee. And so that's our schedule for this morning. So I will have let's see, Penny, you have, I'm looking down too far. So our resolutions to proceed, Penny Doyle will go through this list for us and we will knock out our resolutions. So Penny?
Okay, the first item is to approve a utility permit from Brightspeed, and this is for Danville Amity Road, and it is a Knox County project.
You'll take a motion for that?
Yes, I'll take my motion.
Second.
And those in favor say aye.
Aye.
Requires all 3 signatures.
And there was someone that just came in the door there and walked back out, so maybe that was them. He had a bag over his shoulder.
The second item on the agenda is to approve a resolution for the transfer of duty weapons to retiring deputies at the Knox County Sheriff's Office.
Motion to approve.
Second it.
And those in favor say aye.
Aye.
And then Barry, you might know a little bit about that as to
Yeah.
when a
When the
deputy
deputy
retires.
retires, they have the ability to purchase their weapon that they carried for usually a monetary amount. I don't know if we've ever discussed that amount, but yeah, they can purchase their weapon. And I mean, really, they carried it, it's old, so it isn't like you can reissue it and do it.
Has their own notches on it.
Yeah.
Okay, Penny, thank you. And then we have a series of resolutions to transfer funds, so we'll and Penny and I talked earlier today about there's a certain process that Job and Family Services has to go through every year to keep peace with the state and the feds on where money is and how it's being done. So we have several transfers that we'll be doing for Job and Family Services. And so Penny.
The first one is a transfer of $771.25. And basically, this is going from JFS Public Assistance Division over to Family and Children First Council.
Okay, I'll take a motion for that.
Motion to approve.
Second.
Those favors say aye.
Aye.
The second transfer is from Job and Family Service Public Assistance Division over to Family and Children First Council. And it's $2313.75. So that's $2,313.75.
Motion to approve.
I second it.
And those in favor say aye.
Aye.
Another transfer from, again, JFS Public Assistance Division over to Family and Children First Council, $30,750.
A motion to approve.
Second.
And those favors say aye.
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 Got another one from JFS Public Assistance Division over to the Family and Children First Council for $6,404.25.
Motion to approve.
Second.
And those favors say aye.
Aye.
Another for JFS Public Assistance over to Family and Children First, $19,212.75.
Motion to approve.
I second it.
And those in favor say aye.
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 And the last one is JFS, Public Assistance Division, over to Family and Children First Council, $3,600.
Motion to approve.
Second.
And those in favor say aye.
Aye.
Nothing to sign, just have to do a certified resolution to JFS for them to pass along to the state. And this is something that they do every year. The last item is the TransUnion Master Agreement for JFS. And this is to run credit checks on youths that are in custody, 14 years of age and older.
Take a motion.
Motion to approve.
I second it.
And those in favor say aye.
Aye.
Okay, then skipping on down on commissioners, committee updates. Brenda, do you have anything that you want to
I
share?
attended the Knox Public Health Meeting, their annual board meeting,
Mhm.
and then also their partnership meeting with the executive team. And they placed me as chairman over that, and then we had discussions about officers for the year, and some of the things on their goal was to make sure that, and we'll be hearing from them, but to make sure that people were aware of the services that are offered in the community, especially around behavioral health care and some of those issues to make it more known. And also working with the transit system and some of the glitches and issues that we discussed in the prior meeting. And they are working to do more of a centralized system where the services can be known and then distributed to people, because there's a lot of services we have here to offer, but many times people don't know what's available. And it gets a little confusing and can be bogged down. And so they're working on ways to better communicate to the community what services are available, how to maximize those services and help people know what they can receive to help them.
Thank you. Barry, you have things that you report from any recent meetings you've had?
I do not.
And the only thing I would mention for a committee I was on yesterday for the Cocosing River Advisory Committee, that they continue to be very supportive of our scenic river that we have, and also our other waters that we have in the county. Some of those discussions in the past, there was a group called the River Rangers that there was going to be a grant program to help them clear out debris in the rivers, and then that grant disappeared. So we were going to follow up to find out what happened on that. So the problem with when trees fall into the rivers, it ends up being that many times that tree is on private property and not on public property. And so you have to get the landowner's permission to go onto their property, and many times they're reluctant to do that. And that may be because they have crops out in the field and they don't want you taking heavy equipment out there that damage their crops and their soil. So I was in that meeting yesterday, and then that's pretty much all we've had talked about. The issue 2, remind everyone to vote for that when we have our primary, or our May well, it's not primary because we're not having anybody we're voting on, but we do have issue 2, and there must be an issue 1 out there, and I haven't heard about it. So
I have not heard issue 1.
at this point, we will be taking time off for 20 minutes. Because we will wait for Zach Green to come, and he'll possibly talk about the annual report that Commissioner Cassie just talked about. And so we will be in suspended motion for a little while. Thank you for watching. We're gonna go live here. We've been on pause there. So we.
I printed it
Welcome, Zach.
for them,
Thank you.
and they've been reviewing, so you're gonna get bombarded with questions probably, so.
All right, well, if I don't have answers, I'll give back to you.
My third day in a row to see you.
What's that?
I said my third day in a row to see you. All these
I
meetings.
don't know if that's like more, I'm sorry.
Yeah.
Or,
Okay. Well, welcome back. We have our illustrious guest from the Knox Public Health here, Zach Green. Thank you, Zach, for being here. And you're going to wow us with your information, and then we will wow you with our questions of ignorance.
well, I look forward to both of those. Yeah. Well, good morning, as always, Commissioner Barry. Thank you for being here. Nice to actually have you. Official, and then Brenda as well. I know the last couple of days we've had several meetings, so
Yes,
thank
we
you
have.
for
Thank you.
being there for the DAC. It was a good turnout, and Cameron does a great job every time. And
And the DAC is what?
the District Advisory Council, which is
Okay.
responsible for appointing our Board of Health members.
Okay.
And we had a quorum, and we had two individuals that were reappointed, Dr. Amanda Rogers, thank you. I kept wanting to say Barry, I don't know why, Dr. Barry George, and then Eric Zakinen also as well. So awesome individuals to have on our Board of Health and continue to pay dividends each and every month when they engage our team. So thankful for that.
How long do they hold those positions?
So they are 5-year terms.
5 years, okay.
All right, so where are we at with lovely influenza season in particular? We started to peak at the end of January, in particular influenza A. Started to see somewhat of a decline in those cases about mid-February, and then we shot back up in hospitalizations and positive cases in general through all of the remaining February. As of today, we are starting to see a decline in our hospitalizations and overall cases and wastewater. So we're hopeful that we're starting to continue that decline. It is slight, but it is starting to trend in a position that I feel like hopefully we're getting to the tail end of that. Now, I do caution the aspect that majority of our influenza cases in regards to influenza B has only been about 10%. So we're hopeful that that does not become an issue. We have no reason to believe based off of our trends with wastewater over the last 2.5 years that we'll see that. But we are still trying to bring everything back from the pandemic. As some of you may know, RSV and influenza throughout the pandemic really kind of went to the wayside in positive cases. And we lost an epidemiological response of what we've seen over the years. So we're starting to see that draw back in. So we'll continue to monitor that. And obviously wastewater is a great tool, but for epi response, only have 2.5 years of data. We really need a 5-year data set to be able to reel that in.
COVID? I mean, we've heard of a few COVID.
Yeah, so
cases
we are,
that-
that's correct. So we did have a uproar with influenza through February with RSV and COVID. Both of those, in addition to influenza, are starting to see that decline. Hopefully as the weather, not today, but starts to break away and everybody starts getting outside. Hopefully we can really see those cases diminish as we enter lovely spring that we're all waiting for, which is what? 2 weeks away, less than 2 weeks away. Does not feel like it, but
Next week.
yeah, hopefully.
I had heard that Knox Page's groundhog says there's gonna be 8 weeks.
Is that right?
Yeah.
Well, Cheryl, thanks for being here. You can leave. Grief counselors. So we have a gap in our community identifying individuals that can provide grief counseling. We have now 3 individuals that just finalized that. In addition to community health workers, our patient care navigator who works with individuals that need Medicaid, Medicare sign up, et cetera, is going to jump on a piece of the community health worker component with the community health hub out of the CHAP hub out of Richland County to work with pregnant moms. We continue to identify that those opportunities are evident in our community, working with Richland County, who has the jurisdiction out of Knox with the CHAP. that's an access point, notices that we do have some families that are in need for pregnant moms in particular. So providing additional resources and then connecting them to those resources in our community. So we're looking forward to Lillian Collins to jump into that field. Hopefully in April, she'll finish her training for that opportunity. So we'll see what happens. We did write for a grant with our partners at the federal level to be able to onboard additional community health workers. Community health workers are individuals that don't have any set expertise. They're just kind of like a lay individual in our community that individuals are very familiar with and are comfortable talking to. And we connect them with them where they are in their homes and be able to provide transportation opportunities. Hey, don't forget you have an appointment tomorrow at 2, right? It's just that additional resource, that hand-on-hand connection with a community member that everybody knows and trusts, and it's not somebody showing up in a official capacity, although have good things and, you know, a caseworker in particular, but they're still part of an agency. Try to break some of those barriers. So we'll see, as we know, with all the executive orders that continue to be brought forth, what our federal fundings or even opportunities look like. So that will all be contingent on being able to be awarded some of those funds, but we are still pushing forward and hopeful to be able to bring some of those monies into Knox County. We'll see what happens.
So the community health workers, then
Yeah.
how do they know that this person needs that TLC?
Yeah, so with the CHAP hub, it's connected with all the service providers in the area of identifying, hey, so-and-so has requested an appointment, et cetera, that they're not showing up to, or they are, they're connected in regards to that, but there's barriers. So we connect them with the community health worker. Does that make sense? It
Well,
could
when you
be,
say providers, I'm assuming hospital, doctor's office, is that who we're talking about?
sure, but it could be service providers as well. It could be JFS. It doesn't have to be
Okay.
medical driven.
Okay.
Yeah.
Good. Thank you.
Continue, well, downtown development. So we continue to move forward with our downtown development plan. As you guys know, or some of you guys know, we have a draft master plan with an architect, just trying to see what the downtown development looks like for us moving forward. For those not familiar, we purchased at the end of 22 about a block and a half of city property on West Vine Street. We are operational at the Mount Vernon House Center on 202 West Vine Street. We activated that March of last year. We continue to see individuals in a medical capacity at that location. In addition to that, we moved our women, infant, and children division, which was right next, it was 809 Coshocton Avenue. It's right next to the Kroger fueling station. We moved them back to the main as we outfitted 206 South Mulberry, which was a former suite that we occupied in medical services. We outfit that now fully as of the first of the year for behavioral health and substance use disorder. Working with Dr. Brian Barquette. Brian comes from the Granville area, and Brenda, you heard some of this already, so I apologize. So Brian focuses, he's a psychologist by trade, but he focuses on trauma, in particular biofeedback. Mental Health and Recovery Board has provided Brian and his team with some funding for first responders, and trying to get Brian and his team into the community. We're gonna be able to offer a few office spaces for Brian to outfit. He acts as his own independent provider. It's not part of our agency, just trying to bring that resource into our community. And as our last conversation with Brian, he's hoping to be operational the first part of April. So I'm looking forward to being able to bring that into the community.
So the property that you are on Vine Street, you said you're visiting with an architect now on that?
Yeah, just drawing some master plans of what this could look like, you know, what office space needed.
There's no real determination on build or anything like that.
We have not got, yeah, we're just strictly in the planning design phase of this, and then we will establish a capital campaign committee and say, this is really what we see as a 5-year plan, and be able to draw that up and go forward from there. But my leadership team and I presented this to our all staff on at the end of the year in December, which is valuable, right? It can be difficult at times, like any good leader will say, you know, you get too many individuals involved, how do you move forward? But providing some buy-in from the team and what they do day in, day out that we take for granted or that we're not accustomed to, it was necessary. So going through all those notes and then working with the architect saying, well, we don't need a wall here, or, you know, and I don't want to get too granular with it, but there is a piece of that flow that's necessary that you have to go through.
Thank you.
Yeah, absolutely. Dr. Beck is our new dentist. Dr. Beck started with us at the beginning of the year. As you've seen in the annual report, and I know, we'll get to that. Dr. Solly retired from the agency at the end of the year. I think it was November. Very fortunate to have Dr. Solly, but very excited for Dr. Beck to come in. She has federally qualified health center experience. And is working primarily at our Mount Vernon Health Center or Mount Vernon location on Upper Gilchrist. Ohio EPA dollars for wastewater, sewage repair for existing. We've been shooting for 150,000 annually. We were awarded 75,000 this year, which, hey, we'll take that money. But as Trina knows, talking with some of the township trustees, we, the community, finally have started securing those funds into our community. I'd say 3.5 years ago, it was no more than 5. We, all that money for the most part stayed at the state level. Whenever we're able to get applications in, community members were like, I don't want to tell them my system's failing. I don't want a $15,000. I get it. Like, I fully respect that. But working with our trustees really paved the way of being able to capture those state dollars and bring it into Knox County. So we do have an additional 75,000. Again, that is for existing systems, not for new builds, for replacement or repair, depending on what their situation is. And it is owner occupied, and it's based off of household income. That's how they determine, potentially what subsidy that those homeowners
And
would
they
qualify.
apply to you for those funds.
Yep, and we work directly with the family. We do all the administrative work for them, connect them with installers, do what we can to ensure their system operates.
Yeah, so on your inspections then,
Mhm.
because I know there for a while it was like, yeah, we need to inspect all these.
Sure.
And you don't have the manpower to do all that.
Sure.
So how do you determine which ones you're going to inspect? Is the neighbors complaining that that happening, or?
Yeah, two factors we do. So as far as the O&M program, operations and maintenance is what you're speaking to, which I believe was 2017 is when
Yeah.
that came into effect. And you're right, we don't have the manpower, nor are we going to go door to door and say, hey, guess what? You drew the lucky number day. We're going to check your system. That is not what's happening. So 2 factors: either A, we have a complaint, so we need to go out and check it. That's going to be part of the operational maintenance program, or you put a permit in for a new build. That starts your 10-year. So then we go out, we inspect it, we approve it. Now you're on the 10-year O&M program. So yeah, we're not going township or road by road. So just to be clear, thank you for asking that.
Well, I knew when that came out, there were a lot of people that were really concerned.
I get it.
That,
Yeah, I get it. And the reality of it is, although I think the program was put out there in good faith of saying to ensure, the reality of it is, I don't know of any county that has manpower to even go out and say, okay, we're doing a dye test today.
Yeah.
Like there's got to be some realistic approach to that. Emotional health forums. So part of our community health assessment and improvement plan, access to care, behavioral health, and housing insecurities are our primary focus. Creating awareness and acceptance in behavioral health, emotional health, mental health, substance use. One of our strategies is to get in front of the community with our panel of professionals all through our community, different organizations, and where citizens can just go and ask questions, right? What is this? Emotional health is a reality. Every single person struggles with it. Sometimes it's chronic, sometimes you're just having a bad day. But the face the fact, and I'll be more willing to admit, you can't walk through this life without experiencing trauma. So why do we shy away from or not willing to talk about those things, right? So it's a culture shift and realizing that it's okay not to be okay. That's what I expressed to my team. Go out there, get some help, talk to somebody about it. So the emotional health forum slated for April 29th, date yet to be determined as we look for a venue. Hopefully, I think they narrowed it down to 2. So Cheryl, once I get that squared away, we'll get that information out to you. But we did this last year as well. We had about 50 community members in attendance. It was a little over 2 hours, and we had great community feedback and engagement. I was pleasantly surprised that it was individuals not only willing to show up, right, but be asked those questions that humans tend to shy away from, like, it's my problem, I'll deal with it later, right?
So what's that called?
It's an emotional health forum.
Emotional health forum.
And the strategy behind that, Bill, is when you say mental health, it automatically has a stigma behind it,
Mhm.
Yeah.
right?
Sure.
So the tactic there is it's your emotional health. I mean, it's one and the same, but where am I emotionally? And what's going on in my life? Social, or excuse me. I want social determinants of health. We're not going to talk about that right now. School-based health centers. So we are working with Centerburg and a planning grant to determine opportunities to meet the kids where they are. We have initiated one opportunity in that planning, and that's portable behavioral health. Hiring a licensed independent social worker to go into the school, have a caseload, and meet those kids in an environment that is stable. It's something apparently that Centerburg has done in the past, so they have some logistics already squared away, which is great. And then the other piece is acute telemedicine. So individual, well, Johnny comes down, doesn't feel well, we can connect them with a provider immediately. So mom, dad, guardian doesn't have to leave work, et cetera, to drive them in town. We're working through the logistics of that plan.
So is that a Zoom type thing?
So it'll be telemed, yeah.
Okay.
Yep. And it would also be available for faculty at this point. The next phase of that, if successful, obviously we would open up to community members as
Sure.
well in that
Mhm.
area. And also Mount Vernon High School. So working with Superintendent Cedar and other behavioral health committee with all our agencies that participate in the emotional health forums. As you guys are probably aware, Nationwide Children's has a community health center there as well. There is about 1,200 square feet, give or take, attached to that Bill is transitioning those rooms, that area, into rooms for mental health. So working with all the providers of, hey, I know I already have so-and-so as a caseload. They have a study hall, third period. Can we connect our kids with their therapist at school, trying to create some type of foundation for them? So it's great. I think there's a lot of things that obviously we got to work through. It's new. But I think there's a lot to be said. Controlled environment, the kids are safe. Parents don't have to worry about running them around afterwards. Our providers open late enough to create access. So we're just trying to break some of those natural barriers.
It's a great program.
Yeah, for sure. I look forward to seeing how we can truly gain traction. It's going to take all of us, right?
Yeah.
It's going to take all the behavioral health professionals in our community. It can't be owned by just one agency. Let's open it up. This is not a competition, and I stress that constantly. It's not about, hey, we own this area. No, it's open. We got to find a platform to be able to reserve it. I don't care who the agency is. Are we getting the needs to those kids?
Yeah.
Right, it's about helping people.
Yeah, 100%. Without a doubt. And the last thing, before you guys destroy me with my annual report,
Yeah.
how much time do I have? If I keep talking, I can't ask questions, right, Penny?
You
Well,
have
we'll
about
stop you when.
20 minutes.
And we hired our new CEO of our community health center, Shauna Schott. She started at the end of January, and I know Knox Pages did a great article on Shauna, but she's the newest member of our team, and excited to have Shauna.
I met her. She's nice.
She is, yeah, I think she's gonna be a great fit, not just for our team, but for our community. So.
Great.
All right.
Would you like to talk about the 2024 annual report?
So I have an option on this? Is that how you're delivering?
Well, I phrase it that way, but then the next follow-up is you will be talking.
No, yeah, of course. What's up?
We appreciate you be able to get these reports out to the community. And then Patty kept saying, well, it's right on their website. So if you can't answer it, we know we can go to the website and get the answer.
Sure. I'll do my best.
So you gotta go right to the chart to recap and statistics. Is that where you would?
I have them open. I'm just ready to rock and roll.
Okay. Who wants to go first? Well, I'll go first. I'm concerned that in 2024, it didn't show that you did any inspections of the 12 tattoo shops.
So that's plus or minus based off of the previous year.
So you did do inspections?
But it was the 12 that was already existing in
Okay.
23. So
So you did
12.
do them, you just didn't.
We didn't have a plus or minus from the previous year. So it's looking back on 23's compared.
So on all these numbers and like on the sewage inspection, the
Mhm.
209,
Mhm.
so that's 209. That figure is 35% less than what you did before. It's not the total figure.
That's correct.
Okay. So if we wanted to know what the total figure.
No,
of
no, no,
sewage
no, I'm
inspection-
sorry, 209 was the inspections as we conducted, it was 35% less.
That numbers, but that 209 was the actual
That's correct.
inspections.
Yes.
That's the reason why I was wondering on the 12 tattoo shops. You know, does it look like there
Yeah.
weren't any inspections?
Yeah, no, it's a trend based off what we did the year prior. So 23 versus 24 is what they're trying to identify. So in 2023, we conducted 12 tattoo shop inspections. In 24, we did the same amount. So
Okay.
that tells me that we didn't have
How
it
many
anymore.
tattoo shops do we have?
Well, Bill, if I had to give an answer to that, I'd say 12 because we're mandated annually to do that. So this is a guess.
Yeah, we just didn't think there were that many in the Knox County.
Sure.
Because Barry always goes to the same one.
It's hard to
Out at the
find,
jail.
it's hard to find that many restaurants. How do we have that many tattoo shops?
I stick my arm through the bars out of jail. My bit, the one that I'd like explained is the biggest number on here, and that's the Narcan dispense.
The what? I'm sorry.
Narcan.
Narcan?
Narcan
Yeah.
dispense.
The 554.
98%.
Right under public health.
I got it. Yeah, so 544 naloxone dispense. So we went into a regional grant with Union County. Actually, they were awarded part of our central region. They were our primary award. And being able to dispense additional naloxone. So Narcan is the reverse agent for individuals who are overdosing.
Right.
So yeah, no, just our team getting out, working with community partners, having individuals come in to the agency. We are actually just today, I think, it might have been yesterday, started installing them next to our AEDs as well.
Okay.
At all our locations in the event that, you know, someone has an
Yeah.
event and you're not sure if it's an AED related, you know, if it's cardiac, if you need to be able to push Narcan. So we're trying to create that opportunity for community members. So yeah, no, the increase in Narcan distribution is just simply creating that access of potential mitigation of
Sure.
ongoing overdose deaths.
It's just a big number, you know?
It is, sure.
So it's not to say the addictive substance abuse is up that much. It's just that we're responding to it with more
That's correct.
resources.
So that's not administered Narcan, those are dispensed. So that means I'm giving that to you because maybe you have a family member or, hey, look, I've been trained in this and I feel comfortable carrying it to the grocery store. So that is just opportunities out in the
Okay.
community of individuals being able to respond.
Yeah, the ability to have it.
Yep.
Yeah, because initially I was thinking that you guys were dispensing and been like, usually that's
Yeah,
EMS
dispense
type
is non-administered. It is
Okay.
just
Okay.
readily available.
Good to clarify.
Explain something to me being a less than novice at this.
Sure.
When I see something like Narcan.
Mhm.
And you know, there's a lot of children out there that need an EpiPen.
Yeah.
The justice scales seem to be unbalanced here, because I know a lot of the kids in the community cannot afford an EpiPen who
Sure.
absolutely need it.
Sure.
Now, I'm sure that through your department, if they're aware, they can probably get some assistance with that. But when we talk about, I mean, not to be that critical guy,
Mhm.
544 Narcans distributed, and
Sure.
knowing that there's an EpiPen out there needed,
Yeah.
it confuses me a little bit.
I get that. I get that. And I can't speak to individuals who identify
No.
those said funding revenues
Right.
to
Yeah,
be
no,
able
I
to permit
get
that opportunity. The only thing I guess when we review fatality, so we do have a fatality review board. So we look at child fatalities, we look at overdose fatalities and suicides. Quarterly basis. You're not seeing, thankfully, and I do not want that to change,
Yeah,
right?
sure.
Individuals having a high mortality rate because of
Because
an
they didn't have
allergic
the-
reaction,
Yeah.
right? It is primarily chronic drug use,
Yeah.
mental health awareness,
Sure.
right?
No.
It goes hand in hand
I get
along
that.
with suicide. And the one I hate reviewing the most, and to be frank with you, is when we have to get fatality review and say, what preventative efforts did we miss here? And yeah, there's some things that natural causes and you can't do that. However, there are some that we review that are prevented.
Well, I can
This
tell
could have
you-
been prevented.
I can tell you this, one of the topics, when Commissioner C and I went to new commissioner training
Okay.
for 3 days in Columbus, one of the big things that was brought up about your departments is how people have the rights to place a child in an area without approval of that particular area. Do you follow what I'm saying?
Yeah.
Like if Franklin County wanted to just place a child in Knox.
Yeah.
There seems to be not enough research from what I hear that puts that child maybe in harm's way just by the placement of another county pushing into our county, or
Yeah.
any county.
Yeah. And that really comes down to our lawmakers.
Yeah.
And working with JFS, actually, I had a conversation with Danielle yesterday. We are gonna move forward with that and we are gonna
Yeah.
discuss that matter.
Well, I think the general consensus there was they were gonna push this, our state representative and congressman,
That's correct.
number one,
Yeah.
to come up with a law or a resolution that says, you know, the county that is receiving the child has the authority to do the research and maybe say, wait a minute, no, this
Yeah,
foster
yeah,
group
yeah.
isn't good.
Yeah, exactly. And just to kind of recap real quick, individuals that are placed in our community, for example, due to state custody reasons. There's nothing in statute that says that placing county has to notify the incoming,
Right,
right? So Franklin County, for that example, could be any county, placing a child in our jurisdiction. There's nothing that states that they have to notify our JFS partners,
right. And
let
that,
alone approval component.
that was
Yeah.
a pretty good topic at this.
Oh, yeah. No, that's, we're gonna hit that hard.
So you are
Yes,
probably well aware.
Yeah. I stand behind that all day long.
Yeah, good.
Yeah.
Me too. I
Yeah,
mean,
for sure. Yeah, for sure.
So on, up at the top, vital statistics.
Mhm.
2043 birth certificates.
Mhm.
I'm assuming that a lot of that is not because of the current births, but it's because people were saying, oh, I gotta file social security and I don't have my birth certificate.
Yeah.
So I need to get that.
Yeah, just because an individual, that does not reflect 2043 births, to be clear. That is individuals in eager to B&B, needs to get a passport, needs to register for school, needs an official birth cert.
And then on the death certificates, so when a person dies, a lot of times you're going like, I need 5 death certificates to go to the insurance. Is that all those 5 for one
Yes, these are
person?
all that
possibly?
are distributed, that does not reflect actual deaths.
Okay.
And we could have more births and deaths.
Yeah.
Right? Just because they're not actually secured or actually certified at that point.
Yeah.
So these are just distributed.
And then down under the public health and nursing division,
Mhm.
1,227 communicable disease cases. Does that also, do you get stats from the HOCO or any other providers? Are those their stats and the people they serve included in these?
So if it's a
numbers?
reportable disease, it goes into a state database, the High
Okay.
Disease Reporting System, ODRS. So regardless of where they're going, if it meets the criteria reportable,
Okay.
it goes into ODRS and we can track that accordingly.
So these would be all individuals, or are any of these duplicated on that communicable disease?
It's possible to have duplicate. I mean, if you have Lyme, for example,
Okay.
in, the June, and then you end up having influenza and you're hospitalized, I guess it could be some
Okay.
redundancy in that regard.
Okay. Then I was surprised by the 20 lead reports in that
Mhm.
same section. That I thought we were done with lead.
We continue to see lead as a problem. Now, I will tell you the threshold for reportable lead for the state continues to decrease, which is gonna
Okay.
capture. So my argument to that, although that's still terrible, that's why we've seen an increase, is the threshold went from 10 to 5, now maybe it's at 3, don't quote me on that. But yeah, you're right. I mean, do we really have lead in our homes? And the reality of it is,
Yeah.
yes, we do. And we are seeing adverse childhood events for these kids.
State of the home
Happen.
probably dictates that, I
Sure.
would imagine.
Yeah.
And then on the 276 home visits.
Mhm.
Does that also include the home visits by those that are working with our seniors?
That is for our seniors.
Just as the seniors.
Yeah, that is not it.
276.
That is our,
Okay,
yeah, that is Natasha Lester.
okay.
Yep.
Yeah, it's
I know
good
that
to know.
woman.
Yeah, no,
And
that
I
is.
assume she's doing a superior job.
Yeah.
and Probably needs a pay
I,
increase
I wish,
because of
I
that.
honestly, and nothing against Natasha, I think she does a fantastic job, but I need about 10 more of her
Mm.
because as we continue to navigate our communities, one isn't gonna do it, but the community health worker component, if we can get some federal subsidy to do what Natasha does on a much wider scale, the impact would be a lot further. 276 is great. How much impact are we creating with that one position,
Yeah,
right?
yeah.
And that's still busy. We need more of that outreach out there.
Yeah,
And then I got a couple more. So the 194 animal bite. So you work with the dog warden and his people for those dog bites. Are these inspections you guys do or, you know,
Yeah,
where's this?
their
list?
investigations. So, yeah, we get notified, law enforcement, hospitals, primary care docs, potentially the dog warden, if they're notified of it first. We get that and then we have to conduct the investigations based off of, are they, do they have the proper vaccines for the animal, you know,
Yeah.
right? Does the animal need to be quarantined? Does it need to go to the next level where we need to get the animal tested for rabies, right?
right.
Yeah, so it's a full blown investigation, but and for those listening, who will listen later. It's imperative to ensure that if you are bitten by an animal, that you do secure that animal in a locked area. So we can do our proper investigation and notifying that. If for whatever reason that animal is no longer available to ask questions, maybe it's a stranded raccoon that ran away. Going through a 4-dose rabies shot is not fun. So if there's any way to mitigate that, I would highly recommend.
Yeah.
Ensuring that we can do the investigation so we can roll that out.
Well, I see we're at 11 o'clock. I still had 10 more questions, but we'll have to stop there. Jack, and I'll keep this for when you come back.
I appreciate that.
I'll try to get you that list in advance, because I know we wanted to talk about the food inspections.
Okay.
And is that report updated weekly or whenever, if a person went on the website, and wanted to check out what restaurants you've inspected?
So they are updated regularly, weekly. I'm not sure I can
Okay,
commit to that for sure. How often it's updated, that's a good question. I can find out. But they are updated and they are public records. At any point in time, someone would like to request that, obviously they can do so, but we try to do our best to keep that up to date. Speaking of that, we are in the process of looking at a different software program for food inspection, but environmental health in general. It's a little more user friendly.
Hmm.
Where maybe it will auto-populate in those things, so we don't have to cross-make it. High Department of Health is looking at initiating that. Just be frank, I'm tired of waiting. It's been a conversation for 5 years and we're just gonna move.
good deal.
Yeah.
Well, thank you, Zach.
Yeah, thank you.
Wonderful job, Zach.
Yeah, that's great.
Thank you. Thank you very much.
Enjoying learning more over the last 3 days.
Yeah. Now, the community health assessment, yeah, you start looking, are we off? I don't know.
No, we're still
Okay. I'm like, the improvement plan, you know, you start looking at those 3 program areas, access to care, housing insecurities, behavioral health, and it's like. You sit around the community members at the table and you're just like, how do you start tackling some of these issues? One bite at a time, you know, one bite of the oven at a time. It's huge. Can be overwhelming though.
I'm sure.
And it's just like, are we moving the needle? Like, then you start to question yourself. All right, well, thank you.
Thank you, Zach.
Yep.
Good help you need anything, let me know.
Have a good one.
Well, yeah.
Okay.
Sure. Thank you.
Note to self, don't provide the annual report in advance. See you guys.
Hurry up.
Oh, jeez.
Okay. Start that for them.
gearing you up for that.
So as we're waiting, it'll be Julie Miller and her entourage. Committee. We're doing our senior levy evaluations.
He's done that. Sorry. Catching up. Hi.
Yeah.
Morning, everybody.
Yeah, let's do that, yeah. So you're
My
gonna
friends are
bring your
still out.
peeps with you?
Come on, guys. I'm sorry, what?
You're gonna bring your peeps with you?
My peeps are here.
Good morning.
Here, I can scoot down.
Yeah, we can take Cheryl out.
Oh, Cheryl's fine.
I'll take this.
We taking the back row, right?
Yeah, go ahead, yeah. You can go ahead and make comments on our phone while you're going too. Yeah, sit at the front table. We want to make sure that your mug shots get on the internet.
Maybe I've never said that.
Yeah. Both of you guys aren't wanted on anything. There's a arrest warrant out there for you.
I think I'll believe that.
Okay, so you just heard good news from the health department, huh?
Oh, yes, that's always good news.
Looked at it.
So Julie, if you'll introduce everybody. so
Will.
we'll have that on
So
the record.
we are your current senior levy advisory board, or SLAB as we're lovingly called.
Some of us.
Some of us, yeah. And so I'm Julie Miller. I think I met all of you, but this is Ron Roberts. Ron, why don't you just tell me a little bit?
Okay, I moved to Knox County in 2016. I live in Centerburg. Former part-time minister and worked for the federal government for several years. Retired in 2020 and so was asked to serve on the board.
I'm Don York. I moved here about 4 years ago and live around the corner on Gay Street. Retired as a chaplain from Department of Corrections.
Denny Dugan, some of you have met before, born and raised in Knox County, current Clay Township trustee for 19 years now. Been involved in the community, that stuff for a lot of years. Kind of represent the southeast corner of Knox County.
So there's 3 other members that couldn't join us today, but they
Okay.
wanted to come and go over
So
the.
you want to share their names so we have.
Sure, we have Deborah Beck, who's a social worker. Matt Swartz, who lives in the Bladensburg area, who was with the fire department down there and has his own business. They have their own business. And Jim Wagner, who is from the Fredericktown area.
So we have 2 representatives for the South.
Well,
East
southeast and east. We lost our representative from the Danville area and haven't been able to find anybody to
Okay,
jump up and down to let me join the committee, so. And I'm just general, the entire county, since I had a
Mhm.
position that allowed me to visit all 4 corners in the middle, so,
yes.
yeah. So the work that we've done, you were sent, or I assume Jason got you, I see Bill, you have a, document, and then, I know that Jason put together the levy distribution, so you can see the differences between the 24 and 25 awards and what was requested.
Yes.
But we wanted to make sure we came in and answered any questions you might have in regards to the funding. On our document, we hope to give you a lot of positive comments. Otherwise, I mean, if there's always something positive about every agency. Trying to do the best they can for senior 60 and up in Knox County, and lots of them do different things. All of them do different things, but the most common theme is feeding or nutrition in some way, shape, or form, whether it's hot meal or pantry or other social kind of meals. But many of the programs do other things besides feeding or nutrition. So
But what questions do you have, or would you prefer I just kind of go through each one?
I
and-
think you can go through them.
Okay. So station break, it's usually and has typically, as far as I can go back in history, and I have only served on the committee as a coordinator for 3 years, has been the agency that's typically asked for the most, funding. And, this year they did ask for 606 and we recommend the 559,000. And primarily because in their application, they asked for money for 2 pretty big capital projects. And the direction I'd received from commissioners previous to Barry and Brenda being on the commission is that we shouldn't look at capital projects so much as much as programming and serving seniors. So we did our best to add up what we thought those expenditures would be. One was a truck and one was a patio expansion, so seniors could be outside. It's not that we didn't think they were great ideas or that they don't need a truck, but with the money the way it is and it's tighter and tighter each year, we thought that it would be best if we reduce that amount because of that. The other thing is that they also, many of them are trying to cover all their salaries with the levy money, which is fine. You have to have people to run programs, but you know, when you look at the request versus it's the ratio between salaries and the request, and who is it really going to seniors? So we looked at that as well. You'll see that in every review concerns, that in every, it should be in every area that we told these, and we told them when we met with them that they really needed to start looking at other funding opportunities, whether it's state or federal grants. Although federal monies is a real issue right now, just because we don't know. But and state, you know, it all filters down. So, but they also, many of them don't require or request donations from seniors, and we understand that, you know, because of budgetary concerns and concerns for the people themselves. But there were a few that have started to ask for a few dollars here and there for meals, which I think certainly will help in the long run. But many of them haven't even applied for other local monies, you know, for things. So we encourage them to check into that.
Yeah, and especially on station break, when you talked about the vehicle.
Yeah.
A couple of years ago, the Centerburg unit did apply for a vehicle to a different grant program.
Right.
They received it and they decided they didn't need it. So
Yeah.
so there are other avenues to get to those projects.
Well, and sometimes when money's tight, right, we all run budgets. You know, capital stuff just has to wait while you do, you know, provide services that people need. So that was one of the other things. We also are, and gentlemen, please speak up if you want to add anything.
You're doing a great job.
Thank you. Is they've done a better job, meaning station break. They've done a better job of showing unduplicated numbers. All of them have, all the agencies have, because we've said this is kind of a requirement, unique or unduplicated numbers. But they also serve the largest number in Mount Vernon. And we understand Mount Vernon is the county seat and has the most population in a metro area. But outside of that, we have the other 50-some thousand people that need to be served. And so we worry a little bit about the money's going just to Mount Vernon residents and not necessarily.
When they request the funding amount, do they show you a financial
Yeah.
report that says this is why we're asking for this?
Oh, right there, Barry.
They do.
Yeah. Okay.
Put that
But
beside,
I'll show
put
you
that
this.
beside your bed at night. You're having trouble sleeping.
Oh.
So, but that's
Yeah.
fine. You don't have to go too deep.
Well, no, I was just gonna show you the form, just so you know what's in the application. So yeah, they have to try to break out, you know, what, there's a couple pages for the budget. And that's primarily the commissioner's request. It's probably how this office tracks the funding, most easily. But yeah, they have to give us. Any questions? more questions about, did you want to see it?
Sure.
Yeah. Station break?
Thank you.
Centerburg Seniors, they're probably the agency that's seen the most growth, and I don't know, if it's where they're located, but they do like I said, every agency does a great job of serving seniors. It comes down to what's the mission of the money, supposed to be spent for. Again, it's that salary ratio, comparison with them. And we wondered if there was some way, one of the members wondered if there was some way they could try to reduce some program expenses that we thought looked a little higher than typical. But they have a lot of great ideas. They did talk to us when we visited, at least I was there, I think all of us, no. Yeah, you were there.
Mhm.
And Denny, when we visited, was that they were trying to come up with ways to, raise money. And then they're doing a community donation dinner, something they're planning. So they were one of the ones who took it to heart and trying to figure out how they can better serve the people in their area. Go ahead.
One of the things that's really helped them is that the Lutheran church that kind of went out of business down there donated their building.
Yeah, they
Mhm.
have a building.
2-3 years ago,
Yeah.
and that's really helped them. They were over in the school before, so they had to put a new roof on it, and somebody donated money for that, but they've got a nice facility.
Mhm.
So it's really helped.
One of our concerns was that half the money was gonna go to paying their people, you know,
Mhm.
instead of it all going to members. She said that half of it would be
Mhm.
used for.
And so with all of them, again, just like finding other funding, we said, try to, improve the way you utilize volunteers. And many of the organizations, not all, but many of them use senior volunteers, which is good. They serve them, but they also volunteer to do other things. So that's one way to lessen costs.
Even though it's a decrease, in what we propose, it's still an increase
Increase
over
from
what
last
they got
year.
last year.
Yeah.
So.
Yes, I see that, because I put it out on the side of my notes.
Oh, what
and I knew that, wanted to make sure whether it was a
Sure.
decrease.
This here has the.
Yeah,
Yeah,
Jason,
but
he
I,
has
but
it
I
as
wrote it
well.
on my
He
sheet. so I
wrote it,
wouldn't
so
have
he
to
could
go
tell the
to
difference.
Right.
That was actually suggested by one of the members and I didn't get it done. So I think Jason went ahead and did that for you. So we appreciate that. And he backed out today, huh? Or Cheryl's standing in for Jason.
Yes,
Is that what that is?
Cheryl sees.
Not all of them got an increase, some of them took a decrease.
Yeah,
Yes,
yeah,
yep.
yeah, no, definitely station break was a decrease. And then Sanctuary Community Action, which is located in Danville, historic program, doing good things for the people up in that area. They're probably the one that doesn't over project, where they ask for the money that they actually need or want. And so that's why we funded them their full amount. They do good work. They do a good job of tracking. We would like to see them do a little bit more as far as evaluation from the people they serve, like is it satisfactory? We assume it is because people keep coming back, but we need all the projects to concentrate on evaluation and making sure that those programs are working the way they should. They also during COVID, stopped using as many volunteers as they had been, and we've encouraged them to reconsider that and bring more, volunteers on.
Yeah,
The other thing about Barb Mickley, who I call the informal, and she'll hear if she's watching, informal mayor of Danville. We'd like to see them collaborate a little bit more with the other senior programs and reaching out, but they haven't done that.
And they asked for less money than they got last year.
Yeah, it's
Yeah,
good. Great
well, but
protect.
again, I
which
think
was,
it's
I think-
because they look at what they need and they ask for what they need.
Yeah.
So,
It was very impressive the day we went there. They were cooking the meals. They do all home cooked meals. They bag them up. Delivery drivers deliver them. They're fresh. The day we was there, was 35 meals they were delivering.
craziness.
We asked her why she asked for less money.
Thank you.
That's all I need.
Yes.
I mean, she was very honest. So
Yes.
that's impressive. That's a
That
good
is
answer.
impressive in our day.
Yeah, it is.
I think one of the important things too is it's not only delivering the meals, but they're checking on the families there. They've called the hospital and call family. They have a form that they all fill out, the list next of kin and contacts. And so if there's any problem they perceive, they'll contact family.
Yeah, that's
So it's
important.
emotional and relational support in addition to
Yeah,
food.
because how many did she say they've found in the last few years?
Like
That
Or
four people that passed away,
Nobody knew, nobody showed up.
till they showed up with the meal.
Mhm.
They have the mowing program too.
Yeah, which is really popular.
Yeah.
It's too bad that others can't figure that out. They have a contract with a lawn care company up there.
Well, and I think they also require the people pay a little bit.
They
Yeah,
do,
yeah,
they
they
do
do.
pay a little bit.
Yeah, because we live in that age where you put a little skin in the game, it's
Yeah.
shown
Yeah.
that you've actually, it really does make a difference.
We did encourage some of the other, Fredericktown and Centerburg to consider doing something like that, to at least look into when we were visiting with them. Center of Hope, probably the one that we have the most conversations about, typically ask for, around $200,000. However, they're only open a day and a half a week. And a lot of it is salary related, and they do good work. I think their building and what they renovate is beautiful. It's in a great area of need. Big concerns with how they prove their numbers. And one of the biggest supporters of the program are Amish. And so there's concern about whether they're truly, doing their due diligence to get Amish information and be able to say they're Knox County Amish and they're 60 and over. But our biggest concern is it's only open a day and a half a week, and they were asking for quite a bit of money in regards, and that ratio with salaries was a big issue. They also have other funding opportunities and have applied for them. However, they have a home base in Whitehall, I believe it is, and a bigger program called Center of Hope. And I don't ever see any money flowing from that base. And I didn't make the visit this year. I don't know if that question was ever asked about that or not. So.
One of my concerns was, which being township trustee, I think you would form the trustee.
Yeah, right, yes.
You get hit up with all kinds of questions that have nothing to do with township
Yeah.
all the time.
Or commissioner.
Or commissioners, yeah.
Well, I got hit up about, we got turned down because our income was too high. It's like, what? Wait a minute. The Knox County, the way I understand it, it's anybody over 60 and over. It doesn't have to do with income. They got denied because their income was
So who's they?
two people and Tim Van Winkle, I can say his name. And
Okay.
it's like,
But they went to Center of Hope and they got denied? Okay.
Well, they have,
because she checks income levels, probably has to do with their funding.
Yeah, it's different government fundings scenarios.
But there could be some way of fighting that,
I would think.
but it's like, I can't do anything about that right now.
Yeah.
this is the form that they have them fill out. They gave me a copy of that. It shows their income level.
The guy I'm talking about is a retired teacher. He's probably 77, 78 years old.
Yeah, this is a federal, it's a job and family services form eligibility to take food home, so.
And it's possible their income was higher than their level there.
Yes.
Yeah, so that was a, concern.
And again, the funding that we recommended is the same as they got last year. It's not a decrease from last year.
Yeah. Yeah, because we hear little hiccups like this, because I'm dealing with one at the station break right now. That a woman wants to play bridge. And there are a couple of people who come up from Licking County so that they have enough people to play bridge. And so they're trying to work, station break is trying to work through that as to, okay, there might be food and snacks there, and unless our levy says Knox County people only, and we know there's other monies that's coming into the station break, and we're like, figure the thing out,
Yeah.
because, the 80-plus-year-old wants to play double bridge, and she's being stymied because of trying to figure out these little tic-tac stuff.
Yeah.
I digress. Julia.
I think it's just the growth and the request and the program. So it's a good thing. It's, but it also has bad sides to it.
Well, the one thing we know is all the stats show lately that we're aging and not
Yeah.
replacing with younger. Our
right.
county's aging
Mhm.
faster than the younger replacements that are coming on board, so.
In Fredericktown, again, a good program, lots of good attendance. Their numbers have stayed pretty much status quo. But they do attract, I know there were a couple people there from Mount Vernon that go to Fredericktown that don't want to go to Station Break. And there's a few of those all around the county. They just feel better somewhere else. But they asked for a little bit more money. We do still have concerns. They did a much better job of tracking their unique or unduplicated numbers this year, but we still feel that it was a little bit confusing, even before and after we made the visit. But we'd like to see them also collaborate. Jim Wagner's familiar, and Barry, you may be too, with the there's two different senior groups.
Yeah.
One of them, this Fredericktown's Senior Activity Center asked for money. The other one doesn't and is privately funded or whatever. But we'd like to see them kind of do a little bit more together and maybe it's a click thing, like back in high school. I don't know.
I would
But
imagine
we
you're
did
onto something.
we did encourage
I mean, seniors have plates too.
We did encourage them to do that. And we funded them a little bit more than we did last year, just because they're wanting to do new programs and we encourage them to do them. So,
So what did their programs, because they have like exercise equipment there or not?
the high school owns the equipment and they
Okay.
can use it if they'd like to.
Okay.
And according to Jim and even Cindy Alt, the director, a few do, but not too
Okay.
many. So,
Okay.
yeah, they don't own or upkeep that equipment. Yeah, so they do, they had the most passionate folks when we visited. They kind of had a lot of questions.
I think it's mostly socialization.
Yeah.
They don't have a licensed kitchen, so it's kind of like a big potluck sort of thing that they
Mhm.
do. And play games and stuff, so.
A lot of that. Knox Health Planning, which is the nonprofit arm of Knox Public Health, requested 75. We funded them more than we did last year, or recommended funding more than last year. I think the committee, and I'm looking to my three friends here, feels it is probably the one that actually meets the mission as it's written of the levy mission right now than the rest of them do.
Mhm.
This is a public health nurse who's also a community health worker. I heard Zach talking about it a little bit, who goes into homes. She has to ask permission. It's all voluntary, but they're referred by EMS or the hospital, long-term care, whatever. She goes and does an assessment, whether it's nutrition or risk, like fall risk or nutrition risk or medication safety. If they need a ramp, she figures that out. If they need one of her first ones, I was still close to the program, was about getting a guy a chair lift, a recliner that lifts so he could get around his house a little bit easier. And again, that was funded by a private donation or maybe one of the service clubs. But yeah, that other than needing volunteers for that program or figuring out how the nurse can get some help and doing a little bit more about their data collection, they can do unique numbers because they're not thousands or hundreds. But their program is just right now a spreadsheet, and all of those that give us spreadsheets, we encourage them to look at something that's a little bit more substantial, but it still works for them right now. What else on that program, guys? Anything?
It is a very well-run program. And like I say, the mission is to keep the people independent in their houses. If she goes in and checks on them, helps them with their medications, blood pressures, and this and that. And plus, you see, it's a big increase from last year, but if you remember, we gave them 40 last year and you guys needed to pull some out, remember?
Yes. And part of that was the report this year, because I pulled it out, because I knew there was a concern last year that they were actually duplicating what we were paying the area aging 5 to
Mhm.
do. And when I looked at the report and go like, no, it's not even in the
Mhm.
same world,
No.
universe. And so, yeah, I agree with your assessment that this is certainly a program that we need for our seniors to keep them healthy in their homes. And to have someone that, they can reach out to and have a friend to be able to assist them to do this.
She also takes them to appointments, so there's a lot going on
She's
there.
like
if
a
she
navigator
can.
then.
She is. She is, but she can do so much more. And so the concern with that program is, unfortunately, with healthcare being the way it is, if I was only 30 years younger, I would go after healthcare, but they can't get any funding. It's not a Medicaid supported program. The only Medicaid supported program that she could do is with prenatal. They're still funding for low birth weight and premature babies, but
Probably
they
don't
keep
have
looking
Dennis
at
Peters
how,
delivering it.
yeah, they keep looking at how they can potentially use insurance or health insurance reimbursement to support this program.
Nurse loves her job.
Yeah,
She's one of the best agencies on, getting referrals and referring back to other people that need it. So she uses that system really well.
And definitely necessary.
yeah.
So
It's-
who is that nurse, Barry?
If I'm not mistaken, it's Natasha.
Natasha Lester.
Happen to know her. So do
Moving on, United Way, asked for 25 and, we funded them, and you can see the farmer's market about the same as we did last year. United Way always, the last time they applied did as well, ask for money for tax assistance, which since I did volunteer in the tax assistance program, I can tell you it's well worth the agency providing it. However, we don't feel like it meets the purpose of the levy. It's great if seniors, and they save seniors money, but meeting the mission currently of the levy, we didn't feel it was. So the money that we did fund them would be to support their resource navigator, Walt Lewis, who does an amazing job doing what he does too. They can do a little bit better on their data collection and making sure that people are 60 and over Knox County residents, but he
They do
does,
have a new director
yeah,
this year, so
they
that was probably a factor.
they do, he does refer a lot and works with Natasha and area agency and all the senior centers, so. The farmer's market, it's a token project. I don't know if you're all familiar with it. Seniors get so many tokens. And they need to do a better job of, evaluating the whole thing as well as their data collection, although they do pretty well. They do have a program they use. They didn't, so we moved to quarterly reporting, and we had been monthly, or we're moving to quarterly reporting, and they didn't report as they should, although they're really only operating with the
During the
tokens
summer.
May through October. So it may be that we have to look at that a little bit differently in the future. But they have a lot of programs that the Task Force on Older Adults does that they support. But we felt that if there was going to be a way to assist them, but not fund them, we'd give them.
Is that a new one for this year?
No, that was a new one last year.
2 years ago.
Was it?
Yeah.
And the only new one this year, Barry, is the last one, the YMCA. They do a lot with seniors. I work there part-time, so I didn't review this application. Everything you see there is from the other folks on the committee. And they just need to do a better job of tracking. What they do is all about stability, physical health, balance, all those programs that do that kind of thing. Maybe you guys want to talk about it a little bit, because I wasn't in on the visit and I
Yeah,
didn't
well, they're
review.
seniors, what they call it, silver.
It's a health insurance reimbursement
You know, it's
program.
good, they get exercise and, this and that. But it's back to the point of this levy is, to my knowledge, is to keep people in their homes. Physical activity and stuff is good, great, but not as well as like the sanctuary and then keeping people in their homes in the health department.
And the people have to come to the YMCA, they don't go out and do anything in the community.
So why is it that you felt that you would give the YMCA any money then?
Well, and let me explain the health insurance reimbursement. So Silver Sneakers, there's Renew Active, there's Silver and Active, there's all sorts of health insurance reimbursement programs. And the Y, so I'm a Silver Sneakers member. And my membership is free to the Y, whether I work there or not, it's free at the Y. The Y benefits every time I use my access card and go into the Y. So let's say I go in once a day, twice a day, 3 times a week. It doesn't matter. Every time I check in, they get cents on the dollar. So the program Silver Sneakers does not support the however member, I don't have all the numbers in front of me, how many members they have, Silver Sneakers members they have. It's only a small portion of that. So they're asking for support for the program because it's not fully reimbursed. In fact, it's less than 20% reimbursement on the number of seniors they have.
So that's a state reimbursement?
No, it's
It's
just
not-
health insurance. So it's
through the
it's
insurance.
United Healthcare, it's Aetna, it's some of the
Okay.
supplemental insurances for retired.
Yeah, usually Medicare supplements and even in Medicare Advantage plans.
Yeah, there's a few.
It's a good program for the senior to get there.
Mhm.
It helps them to be more agile, balanced, stronger, be able to stay it. But they just don't go out to them.
But they are working now, I know, because both Natasha and the executive director talked about it, they and Knox Public Health are talking about what they can do more together with the senior program that Natasha is providing.
Mhm.
And is there a potential for some future stuff? So you can see the bottom line. I know Jason put it on your levy disbursement form. The last page is, of course, the general recommendations that we have for the commissioners. They're pretty self-explanatory. We just feel as a committee that you definitely, as we move into the future, have to be very serious about, they have to look for other funding sources because this levy, whether it passes or not in 2026, which is going to be here before we know it,
Yes.
can really hurt them if it wouldn't fail or if it would fail or if the funding continues to be reduced. And then I think the most important thing for you three would be somehow you have to determine, the ballot language is really general, like most ballot language is.
Mhm.
And I think you three have to look at what do you want the mission of the levy to be? I think that saying you want to keep people independent in their home is too broad.
That's too big a problem.
What does that mean? Oh, we feed people. Well, that's good. They socialize. Well, that's good. We make them exercise. Well, that's good. But I think we need to really consider what it is that you want the mission of the levy to be. And or use it for, or you determine that you wanted to just basically support a few programs. I don't know.
Would you like to submit language to us that you think?
No.
would be-
Do I think you could use some seniors? And I mean, the majority of us are. Deb's not a senior yet, the one on the committee, but the rest of us have been. Matt's not either, right? Matt's not. But it may be that we talk to some of the directors of the programs
Right.
and maybe they can help us. Because they're all gonna say, well, you should fund Centerburg over,
Right. So,
station break.
so my question for you is, these agencies, have you ever asked them if they have a fail-safe procedure?
Oh,
What I
yeah,
mean
we
by
ask them
that
all the
is if
time.
it fails, what are you gonna do?
Yeah.
We ask them all the time.
Yeah,
Do they have, do any of them really have a fail-safe
Not many of
procedure or
them. No.
process?
That's
So
part of their
they're basically
application.
hoping every year that the levy pass.
Yeah, and
Or
every year,
time.
they've all been funded up to about 3 or 4 years ago.
Right.
They've all been funded fully because there were really only 4 or 5, a handful of programs applying it. And one of my goals was, why is it just 4 or 5 programs? There's other programs out there that should be funded.
Mm.
And so, yeah, they need to be, when we, every visit and every time we
But
see
none of
them.
them have ever said, yeah, we have a fail-safe procedure or process if this fails.
They basically all say if we don't fund them.
They're gone. Yeah,
Unless they have other funding already,
Right.
you know, like
Yeah.
Station Break has some.
so pretty much they're solely dependent on,
But the
And-
thing
and-
is, we just need more guidelines to go by.
so the second question leading into that for me is. If the money stops, which we don't know what's gonna happen with everything that's going on. Will there be a way to maybe to consolidate some of these and still make it some stuff available for seniors, or is it just done?
It could be very hard.
In the order to consolidate
The
programs.
county is so spread out, you know, for
Right.
delivering the meals,
Yeah,
you know, that's one thing.
right. So everybody would suffer at that point then, pretty much.
Well, I think if you look at the, you know, the ones that are funded the least, the last three, I think, you
Right.
know, that's
Yeah,
easy.
they would be
You,
fine.
you earn $40,000 if you cut those out.
Right,
And people may do a farmer's market or didn't, whether they had tokens or not, and the Y continues to survive, whether they get that money or not.
right, yeah.
You know, so, and United Way would continue. And one of the questions we did ask was why the campaign doesn't support a portion of the resource navigator's salary now that, he's been in place for 4 or 5 years.
What do you mean by the case?
The United Way annual campaign,
Mhm.
they break it out for all those agencies that they support, but I don't think it's included in their administrative costs. I don't know that for a fact, but it would be a question that I would definitely, and I believe we asked
Okay.
about them.
Good question.
The other things that were specifically asked from people that we visited, was that they asked that the commissioner's office consider applying for monies that might be available at the state or federal level for, seniors. I know you don't have a grant writer on staff, at least the last I knew you didn't, but we did tell them that we'd take it forward. And the other one was, there was some concern about the advisory board members and making sure that, you know, we are representative of the entire county, and that we're not reviewing applications that we may have a conflict with. We don't sign, and the commissioners haven't, and I would suggest maybe we do the next time, is have members sign a conflict of interest statement. It covers you, it would cover me, for instance, working at the Y. And a year or two ago, when Knox Public Health applied, I didn't review that application either. And so I would want to put that down at that point. So I think it's something you could consider. It's difficult to recruit. I know when I walked in, the people were just, application was put in the newspaper, I believe. And that's how Dawn actually applied, that first year that I was asked to coordinate. But past that, it was me just reaching out to different individuals in the community. Ron actually came through my relationship with Tim Ellis,
Yeah.
one of the pastors at the
Yeah.
Church of Christ down there.
At church. one
Yeah,
day.
yeah.
Yeah, good.
You know, yeah. And so I think it's just something that we could consider. But to Brenda's question about could we help with some of these things, or I think all of them would. The four of us sitting here said we would continue on the committee. I do not want to coordinate. That's your biggest issue, is I don't think these three want to, and I'm not going to coordinate next year. I'll stay on the committee, but I don't want to coordinate. And so that's the biggest issue right now for next year. And finding a representative, because Jim Wagner from Fredericktown doesn't wish to continue.
Yeah.
So
Yeah, and I think, I know when we put the committee together, we didn't do some of the usual basic things like term limits so that people,
sure.
yeah, because I know that sometimes you get in a position, well, you have to give us a 5-year notice when you want to go off.
Yeah.
So if we had term limits, at least you know that there is an end to your time if you don't want to, re-out type
Yeah.
thing,
And
so.
we can keep it from ending.
Yeah, yeah. No, I think that's a low hanging fruit to take care of, honestly, is how you recruit your members and get things taken care of that way. But to Barry's point, and you see it on the recommendations, your population is aging, and growing and, so considering the levy in 26, but politically and economically, I don't know where we'll be. And
Yes, yeah.
where everybody's gonna be with paying tax again, so
Yeah.
I know it's one of the lowest property tax requests on my property tax list, but yeah.
Well, we do appreciate your efforts as a committee. And this report proves to the public that you actually are thinking through this and you're not doing the flipping a coin
Mhm.
to see who gets what, and that's good, and certainly it helps those entities that do apply to make sure they stay sharp and on task to work with the seniors. So
And we have a review form that each of us fills out on each of the applications that we grade it, and then we have a spreadsheet that we put it in.
Mhm.
Now, the spreadsheet it's all numerical, right? It's all numerical values, and it doesn't give us all of what we need. When we look at it, it might say fund one agency at $50,000 less than they request, but when we talk it through, they deserve more money than that because they do this.
that's good.
Yeah.
It's part of that negotiation process.
And they know that because we've done those technical advisory sessions, which I think has helped with the applications, definitely
Yeah.
improved the applications. We have that we've had it in December, right, Penny? And, have a couple times where the agencies come in and we go over what's new, so.
Yeah, and then for those who would be considering being on the committee, you do provide them pizza during that.
You provide the pizza, I don't, but we do get lunch, that's our
So
payment.
did we get your 18-month resignation from not being?
Is that what the coordinator? No rules yet. No rules yet. So.
But once again, thank you. Yes.
Visits are very, very helpful.
Yeah, they are.
They get when and watch what they're doing, how they're doing it.
Say what?
I said the site visits are new,
So
you added.
they
because
take
it was never
time
done.
to-
We did them last year,
Yeah.
and this year, yeah.
Necessary time.
That's-
Yes, it is.
Yeah, I don't know if they did them prior to us. We didn't do them the first year. But we have done them the last 2 years and yeah.
I think it'd be
right.
hard to make a decision without visiting.
Yeah.
personally.
Yeah, and we all can't visit on the days we establish.
No.
So for instance, I couldn't go to Center Hope, but I've been there. I was
Yeah.
there last
Yeah.
year. So new people went, I think Ron, you went this year, didn't you?
Yeah, well, I've been there 2 years.
Yeah, so.
Yeah, I think without viewing it and watching the process and all that.
We didn't make it to Centerburg, but since I live in Centerburg, I went to visit just on my own.
Sure.
The
But
first
you,
year.
somebody was there.
Yeah, there were 3 of us there.
Three of us were there.
But you have some agencies that are not as skilled at filling out applications.
Oh,
but
yeah.
Their program is really good. And so,
So you help them with that
Yeah.
process?
Yeah.
No,
when
You
you
do
go
not?
out and talk to them, you can
Yeah.
find out what.
no, the expectations weren't set. I mean, they were handwriting their applications and we said, we can't do it. It's just too hard.
Mm.
And so you have to either get somebody to help you who's technically advanced, or figure out something. And they've all done it. We still get occasional handwritten things.
Yeah.
They've all done it.
Well, and if we ever go after state grants or federal grants, you better be
Yeah.
very well versed in what language you need to use
Yeah.
to convince somebody to fork over the money to help you.
Something for the future too, it's not on your recommendation sheet, I had mentioned it to Jason, was one of the things that would help would be if the commissioners at some point, when your budgets are good, is to be able to purchase a grant application portal where people can go in and just electronically do their application. I think he looked into it and it was a little too much. I know Knox
That might be an Andrew thing. to
Knox
figure that
County
out.
Foundation, I think he looked
Talking about the
into it.
PDF
Yeah.
fillable form type thing.
Knox County Foundation has a couple, because they have their big and small grant, and you just go in United Way, you go into a portal and that whole application is in there and the agency just fills it out, they get a password, and then they can do their reporting through the whole system, but it's probably, everything costs a lot, so I assume it's just too much.
Probably a service that we would have to contract. with.
Yeah, definitely.
In a different pair of shoes, another job, actually, I'll say it that way. I went online in the state of Ohio and got 2 big commercial fans for free. And it wasn't that hard to apply for them, actually. So I think there's ways to maneuver some of that, you know what I mean?
Well, we made them fillable. I mean, Penny has, God love Penny.
Yeah.
She's been really helpful to us, but, so that helped. I mean, that helped making them fillable forms, but a portal would actually secure it better
sure.
almost. And just allow them to go in, take pause, come back, do something, and then that kind of thing.
Yeah.
Well, thank you.
Yes,
Thank you very much.
Thanks for seeing.
Appreciate your service.
Yes, serving and giving has its own reward, doesn't it?
Yeah.
Did you want that form? Or-
No, because I'm familiar with it.
Okay, thank you.
So any other questions from any of us?
No, I think you guys
If we
did
do,
great.
we have your emails and
Some of them.
your phone number on your cell.
And
Yeah.
I'm sure we'll see you before the levy again.
Yeah, I would, reach out when you're ready for that, I would think.
Thank you.
You're welcome.
You have that
Nice
same
to
getting
meet
up
you.
process that I have. I
Yeah,
have to make a little bit of a noise on the way up.
yeah. I saw something on Facebook yesterday. It said, don't feed your kids Rice Krispies. Because I ate Rice Krispies when I was a kid, and now I snap, crackle, and pop every time. I do that. All right.
Thank you very
Thank you.
much.
He's gonna tell you. Gary.
Thank you.
Yeah.
I'll see you around.
So, he didn't make it today because
Housing ends.
weather. was
Housing,
bad,
the-
but,
my
He's
contract-
my spot. On the
Contract
house.
ends, my contract ends the end of this
So we're
month, so I
gonna
have to do we have this meeting
Birthday thing.
tomorrow.
That's
Okay.
good.
9 a.m., right?
Thank you for letting me.
I have a
Okay.
meeting Monday.
Yeah.
I was gonna email you. and
Try to do a
I
final
saw you, I
report.
thought, I can let you know.
See what happens.
Is that his coat? Is that Rob's coat?
Oh, one's over here, yes.
Yeah, we,
Cheryl, do you have anything?
Good, all right.
Thank you.
yeah, see now,
Take care.
thank you.
Thank you.
Okay, do we have other business that we need to conduct? Otherwise, I'll take a motion
Vote on
Motion
it
to adjourn.
today or
next week.
next?
Motion to adjourn.
Yes.
Second.
And we stand adjourned. Thank you.
Thank you.